In 2020, UNICEF reported that the Ebola epidemic in Sierra Leone recorded a total of 8,706 cases and claimed the lives of 3,590 people. 10 years after this deadly outbreak, the virologists who worked tirelessly at the height of the crisis have returned to Sierra Leone. Professor Yoshihiro Kawaoka, one of the world's foremost virologists, led this significant visit, motivated by the development of an Ebola vaccine, iEvac, which aims to prevent future outbreaks.
So what is very interesting is that we studied with Ebola survivors, but we also studied people who had close contact with Ebola infected people, and also healthcare workers working in Ebola hospital. And even though those people did not show any symptoms, but they had antibodies to Ebola virus. So obviously they were exposed but did not show any symptoms. So what this tells you is that there are people who get infected but don't get sick. So it is important for us to understand what is the difference.
In Sierra Leone, there are approximately 5,115 confirmed survivors of the Ebola virus. Dr. Alhaji Omarunjai, a key member of the virology team, emphasizes the importance of these survivors in serving as test cases to better understand the virus and ensure the efficacy of the new vaccine.
Ebola survivors and understanding their antibodies, understanding their immune tolerance, understanding their immunity. We've worked with them for many years, and so we followed them for more than 4 years, 5 years. Now it is over 10 years. So we are coming back again to look at these Ebola survivors because they have a lot of things that they can offer us to understand how this virus acts. So we are able to, one, understand long-term memory, the antibodies, the small molecules that will fight off infection that they have developed inside them because they were able to survive. Are those molecules able to retain long-term memory? Will they remember after 10 years if they get reinfected with Ebola? It is very important because currently everybody will think that the Ebola survivor will be immune. But we also want to know the types of cell that will retain memory. We want to know whether this memory also extends beyond them. For instance, we have pregnant women who were pregnant and they had Ebola, and then those women had children. And we want to know whether those children retain any immunity. Why is it that those children were never infected?
The triangular collaboration between Sierra Leone, Japan, and the US will not only focus on advancing research on infectious diseases, but will also enhance the capacity of young medical practitioners by providing them with comprehensive virology training and expanding their professional horizons. Memuna Tusuma, AYV News, Freetown.